My name is Laura Packard, and I'm the Executive Director of Healthcare Voter. Healthcare is a personal issue for me because I'm a cancer survivor, and the care I received through the Affordable Care Act is one of the reasons why I'm alive and here today. And on our show, we answer your questions with the experts, and also we dig into larger healthcare topics that we're happy to educate you and each other on. So, with that, our first question today is about this new pilot program that could privatize part or all of Medicare if it's not stopped or severely limited. So, Diane from Just Care and Social Security Works, can you tell us about this pilot program with Medicare? What is it and who could be affected?
Thanks so much, Laura. This is a new program that launched in April of 2021 that was started by the Trump administration. And the idea behind it was to, quote unquote, test the ability of insurers and investors and other middlemen to, quote unquote, manage care for people in traditional Medicare. But really what it was a gold mine for Wall Street, because the way Medicare pays in this program is it pays a fixed rate per person that the middleman, whose care the middleman pays for. And that means that if you are in this plan, you may face delays and denials of care. So let me explain a little bit more, and then we'll have another a longer session to talk more about it. But for now, just be aware that these middlemen in traditional Medicare are very quickly buying up primary care practices. And if you are seeing a doctor in one of those practices, you may be part of what is being called now the ACO REACH program or the direct contracting program. In certain ways, nothing has changed for you in the sense that you can still go to see any doctor you want to see anywhere in the country. And if you have supplemental coverage, almost all your costs will be covered. But your doctor now will be incentivized financially, most likely, to limit the care you get and to steer you to lower cost doctors and hospitals. So you need to be on your guard. And for now, what I'd like to do is just advise you that you should ask your doctor if your doctor is part of a direct contracting entity. And if so, whether your doctor has been directed to change the way he or she provides care to you. And you may want to switch doctors, honestly, to get a doctor who is not being directed by a Wall Street entity. That is obviously not an easy thing to do, and continuity of care is really important. So you can also take it slow, but just be aware that you can still see any doctor you want to see, so long as you have the supplemental coverage to pick up costs that Medicare doesn't pay for. And you should hold on to that coverage as this experiment launches and you see where your care is headed. You may not be part of the entity now, but over time, the Biden administration is planning to expand it to virtually everyone in traditional Medicare. Right now, Social Security Works, Just Care, Physicians for National Health Plan are trying to stop the expansion of the program. But so far, we have not succeeded, and the Biden administration is going full speed ahead. They've simply renamed it. And they are hoping that these Wall Street entities will be providing and overseeing the care that people in traditional Medicare have always been able to manage on their own. So really, if you want to think about how this works, it's very much like Medicare Advantage, where insurers are in the middle, only in this case, you are literally assigned to one of these plans if you're in traditional Medicare. You do not make the choice to go into it. You do have the right to opt out. So for now, I'll end with that and turn it back over to you, Laura.
Thanks for that. And so this is something to keep an eye on, and we'll be talking about this in further episodes. Our next question is about the Affordable Care Act. Aleka, even though open enrollment is over for most people, there's a special enrollment period for some folks. And can you tell us who's eligible and for how long do they have to sign up for health insurance?
Great question, Laura. So as you know, now that the open enrollment period is over in most states, you are generally going to need a qualifying life event in order to enroll in coverage through the Affordable Care Act marketplace. If you have one of those life events, generally you get what's called a special enrollment period, and you'll have 60 days to enroll and pick a plan. The most common reason you might have one of these qualifying life events is if you've lost coverage. For example, you had Medicaid or you had coverage through a job and you no longer have that coverage, that's a qualifying life event. If you have a baby or adopt a child, that's a qualifying life event. There are also life events that allow you to change plans or enroll if you've had coverage already. For example, if you're going to move to a new zip code or a new state and you already have coverage, that will allow you to get a life event and enroll in a new plan in your new home. One life event I do just want to highlight because it's new this year is that later this month, actually, healthcare.gov and certified enrollment partners like Health Sherpa, where I work, will launch a new enrollment period for people with lower incomes. So if you expect that this year you're going to make about $19,000 if you're a single person, $40,000 if you're a family of four or less than those limits, you are actually going to be permitted to enroll anytime during the year. That's really exciting and as I mentioned, a new opportunity. So if you think that might apply to you, stay tuned. Later this month, that opportunity is going to go live again on healthcare.gov and also through enrollment partners like Health Sherpa and other folks out there as well. But high level, I would say the number one thing to remember about special enrollment periods is there are many, many reasons you might qualify. If you're not sure if you qualify, call healthcare.gov, give us a ring, find a local assister or broker to help you out. It's always worth double checking.
Absolutely. And especially people that have Medicaid right now for their health insurance may be losing that insurance soon because when the pandemic declaration is over, which may happen sometime this summer, we don't know exactly when. So keep an eye on this, but we don't know when for sure. But at that point, if you make too much money to be covered by Medicaid anymore, you would need to get a new health insurance plan. And Aleka, what should you do if you don't have health insurance now, but you're not eligible for the special enrollment period?
Great question. And you hit it on the head with Medicaid. Medicaid is a program that is available. It's a state-federal partnership that is available year-round to folks who make below certain income thresholds. So generally, if you make less than about $1,500 in a given month as a single person, about $3,000 as a family of four, you are eligible for free or low-cost insurance, again, through that state-federal partnership. That applies even if you think you're going to make a lot more money for the year as a whole, but right now you have an income change and your income's a little bit lower. So again, same thing applies. If you're not sure if you qualify, it is always worth submitting an application. You can do that again on healthcare.gov. Enrollment partners, you can do it through your state Medicaid office or find a local assister to help you out, but always worth exploring that option because it can be a really great option for many people.
Absolutely. And open enrollment will open up for everybody later this year unless something changes from the administration.
Well, stay tuned.
Our next question is from Dave. They want to know, how safe is the Medicare trust fund? Diane?
It's a good question. We never really know, but what we do know is that over the last few decades, there have been projections about the solvency of the Medicare trust fund that have been, 10 years down the road and 2 years down the road. And somehow or other, it always seems to survive, either because Congress steps in and strengthens the Medicare trust fund, or spending goes down, or some combination. So while I believe the projection now is that the Part B trust fund will be insolvent in 2026, that still gives Congress time to address this issue. And because a lot of voters are older people with Medicare, that puts pressure on Congress to behave as it should, and strengthen the trust fund. But with the way things are going these days, you just never know. So Medicare is a national treasure, and let's just expect that Congress will step in.
Absolutely. And it doesn't hurt if you're calling your senators and your congressperson about any other issue, like perhaps lowering the cost of prescription drugs. Also, make sure that they have in their minds that they need to do something to shore up Medicare's finances too.
Very good point.
And now I'd like to introduce our special guest, Geneva Stone from Little Lobbyists, who's going to talk more about Medicaid and home and community-based services. And with that, welcome, Geneva.
Thank you, Laura. Yes, so I'm here with my son, Rob, who is over here. And Rob is a fantastic, wonderful young man who is making a difference in his community by advocating with Little Lobbyists. And he is also an artist and a writer with his own art website. And he has been tremendously benefited by Medicaid's home and community-based service programs. These began for him when he was a child and needed home nursing care. And this helped him tremendously to survive and thrive in his community. And as he went to school, he was able to go to school with his peers. I mean, many people don't really know that not too long ago, 10, 15, 20 years ago, most kids with disabilities were sent to special schools or they were institutionalized rather than being able to remain in the community and go to school with their peers. So Rob continues to thrive with now a new and different home and community-based services waiver that allows him to stay in the community as a young adult. A lot of people also don't know that most children who have home and community-based service waivers lose them when they reach 21, and they have to reapply for different waivers that help them as young adults. So it's extremely urgent that these waivers are funded and funded appropriately. There are tremendously long waiting lists. I think I saw a statistic that something like 800,000 people nationwide are waiting on waiting lists for home and community-based services. So they're all at risk of institutionalization. I mean, nobody wants to live in an institution. Congregate care is extremely dangerous, as we've seen during the pandemic. Tremendous numbers of people have died who have been in congregate care, and we certainly don't want that for any of our children. Laura, are there any questions or?
Let's turn it over to Peter, and then we can ask questions of you both.
Okay.
Great. Hi, everybody. So it's interesting to think about the progression of home and community-based services and what we have now and what we didn't have before. And actually, in some ways, the story of home and community-based services is really part of my family's story. So I have an aunt that I know her name, but I don't know much else about her. And that's because she was born with significant disabilities in another generation's time. And when she aged out of what little services and support she had in school, my grandparents made the choice to institutionalize her. So, I don't really have many memories of her growing up. But I have a cousin who was born with cerebral palsy and has other intellectual and developmental disabilities, who was, grew up in another time. He's a little bit younger than me. And he was able to stay, home with his mom and his brothers and get the services and supports he needed to stay there and be educated in the school system with his peers, and, now lives, independently as an adult as well. So, my family's, sort of history is tied to the history of seeing what difference can be made by, these types of services. And, I'm actually lucky. I I work, my employer, I'm a member of a union, and my union negotiated really excellent healthcare benefits that, as of right now, I haven't had to use the home and community-based services. We're able to use my private paid insurance to cover what we need for my youngest son, Jackson. So I want to tell you a little bit about Jackson. So Jackson is your typical 6-year-old, very strong-willed. Wonder where he gets that from from his mom and dad. Strong-willed child. He actually loves going to school. He actually just this morning made a little school for all of his stuffed animals, stuffed wolves. So a school for wolves that he's created today. He loves playing Nintendo and building Legos with his big brother Teddy too. But Jackson was also born with spina bifida, and he is one of those immunocompromised folks that you read about in the news a lot lately, especially around the pandemic. And has required several surgeries and is actually potentially going to need another surgery in the next 4 to 6 months. As well. So, he's someone who's going to require a lifetime of care. What they say about spina bifida is it's sort of the snowflake where, no two cases are alike. And we're always trying to find, we're always learning something new about Jackson. But, while we don't need those services now, he's, Geneva mentioned the waiting lists. He's actually he's 6 years old, 6.5 years old, almost 7 actually. And he's been on the wait list for 6.5 years for services in Maryland. So, the wait list is a real issue where the services are underfunded, and not all the people who need access to those services actually are getting them right now. But we know, we were able to make really significant and strong investments in Jackson early on. To give him the best, shot at, happy, healthy, independent life, living in the community of his own choosing, with folks that he wants to be with as well. And, in order to have that life, in order to have that support for him in the future, he's going to need support with things like he uses a walker and wheelchair or braces to get around. He also uses a machine that helps him breathe at night. Again, we don't know what else he has in store for us as he gets older, and you're still trying to figure out what exactly types of supports and services he's going to need as he grows into, a young man like Rob. And Rob, it's also great to see. It's been a while since the last time we were up on Capitol Hill lobbying together. Teddy and Jackson had a great time with you.
There we go. This. Hey, Rob. So it's a really important program. It's severely underfunded, and then I think the other thing that a lot of folks don't know about these types of services, once you actually get them, so keeping them is tough, as Geneva mentioned, sort of the transition when you turn 22, but also finding folks to provide the services is tough, right? So it is historically, underpaid and overworked workforce. So, that's why we need things like, the Build Back Better Act and the caregiving infrastructure that was supposed to be a part of that, which would not only expand the services and the wait lists, but also ensure the folks who are providing, the high quality services and supports are able to earn a living wage as well. So I know my family has had, challenges finding the right staff to meet Jackson's needs. I'm sure Geneva can also share horror stories about, how tough it is to find someone to provide those care and services and supports too. Mm-hmm. So tell me, and this question is for whoever wants to answer it. So each state, because it's Medicaid and it's state-based, not federal, each state handles their Medicaid a little differently, right? So are some states better for people that need home and community-based services? And does it have to do with money?
I would say that Maryland actually does quite a good job with home and community-based services. There are a couple of different waivers for children. There's the model waiver in Maryland and the rare and expensive case management program in Maryland for children 0 to 21. And then as children with developmental disabilities transition from high school to adult life, there are community pathways waivers that are run through Medicaid that provide them with aids and equipment and other funding for their community needs, transportation, for example. And so Rob has benefited actually from each of those programs, but we were on a waiting list in Maryland for, gosh, I mean, it was 6 years or so. And it was only when Robert needed overnight care that we were able to get a waiver when he was at risk for aspiration pneumonia. And Rob, you could smile a little bit here. Rob's a little bit nervous. I didn't talk very much about Rob's medical needs when we first started chatting, just because, you know, I've just come to think of him as a person in his own right, you know, but he does have a rare disease. He has dystonia 16, which is a rare form of dystonia, which is a neuromuscular issue. And, you know, as time has gone along, Robert has gotten a tracheostomy. He's J-tube fed, and he's a wheelchair user, as you might be able to tell from here in the photograph. But, you know, a wheelchair is an awesome way of getting around, right, Robert? Robert's a little shy today. I'm trying to get him a smile. But yeah, and finding workers to do this kind of work is tough. Maryland has recently, in the Community Pathways Waiver, has raised wages substantially for people at that program, and those are people over the age of 21. But still, the pandemic has really decimated this workforce. And I think nationwide, you know, we desperately need an influx of funds. We desperately need states to work harder on eliminating their waiting lists so that more children can stay at home where they belong with their families, in their homes, getting the medical care that they need, and able to, you know, participate in school.
Mm-hmm.
And if I could just follow up on something Geneva mentioned too, is the, you know, Maryland does have a decent program, but there is wide variance across states, and you know, what you qualify in one state, you may not qualify in for another state, or, you know, things are means tested or otherwise income tested, right? So in some states versus not in another. So, you know, we have family, Jackson's cousin has spina bifida and lives in Pennsylvania and automatically qualified based on the diagnosis for services there. So yeah, and that's, I think, one of the real challenges is that, you know, also we were told that the waiting list that we're on, like, we would never be eligible for because we were given bad information by the hospital Jackson was born in, right? So, you know, there's a lot of, you know, we have health navigators for just healthcare in general. You also need sort of health navigators to understand the home and community-based waiver system too. It's so complex.
Right. And I would add too, to what Peter is saying, that one of the things that people don't know about home and community-based service waivers is because it's Medicaid and they're state by state. For example, if we were to say one of us, Rob's parents, got a job in another state, and we tried to move to, say, Vermont, which is where I'm from, Robert would not be able to take his Medicaid home and community-based services waiver with him to Vermont. He would have to terminate his status in Maryland, and then he would have to reapply in Vermont for services and possibly wait months, if not years, before he was taken on, which affects parents' mobility. And there have been proposals in Congress to try to make Medicaid waivers transportable, but, you know, right now they're not. But it's certainly something that people could use. I mean, you know, we're a nation. People change jobs. They need to move for personal reasons or family reasons as well. And some families can't, or they can't take jobs in states that don't have good Medicaid services because they simply can't afford it. They would be bankrupted by the medical costs.
Mm-hmm. And Diane, you had something to add?
Yeah, I just wanted to chime in because I think, Laura, your question about variations among state really hits home. Sometimes I think, just picking up on what others were saying, that we're the independent states of America and not the United States. It's even healthcare, right? Just more generally, you can't often get healthcare outside your community. So if your work involves traveling, from one state to another, one CEO of a small business told me it was easier for his employees to get care abroad than it was in another state, but they're pilots flying from one state to another. I mean, it's really, really shameful. But the other big variation between states, in addition to sort of eligibility and resources for home and community-based services, is that many states now, maybe the majority, this I don't know, and so this is the question, rely on corporate entities to provide the coverage. And what I've been reading suggests that people in those states are not getting the kind of comprehensive care that people in states with Medicaid provided publicly are getting. Can someone speak to that?
I'm not sure how Maryland is set up. Has Maryland done work to privatize Medicaid, or is it a public benefit?
The programs, the adult programs are run by nonprofits for the most part.
Mm-hmm.
I don't think Maryland has done too much to corporatize Medicaid that I'm aware of. Now, some of the institutional care programs in Maryland that are run through Medicaid are run by corporate entities, certainly. But as far as I'm I'm aware, say if you require nursing services, well, you're going to be working with a nursing services provider, and those are it just depends on which nursing service you're working with, as to who's ultimately paying for it. But no, I mean, Maryland has not been moving to corporatize things, which I think is wonderful, because I do think that care declines when you're just looking at the profit margin.
Yeah. Could I just add to that too? I think, this is one of the challenges, right? Is that the funding formulas for how the dollars are spent and allocated to the state always, you get more money to institutionalize someone, right? Even though it costs less to provide care at home in the community for folks with complex medical needs and disabilities, the system is so far out of whack that prioritizes, and I believe, as Diana mentioned earlier, sort of the corporatization and the giveaway to Wall Street. Many of these folks operating these institutions or, group homes are, multi-million-dollar businesses, right? And some of them are partly owned or wholly owned, by vulture capitalists and hedge funds. And, they're actually really just a property holding company that operates, homes in order to turn a profit while they're waiting for a neighborhood to flip, and then will flip their home, right? So causing the housing crisis as well. So, I mean, the system is so far out of whack to drive towards institutionalized care in all its ways, right? And it shouldn't be this hard. You shouldn't require a PhD in healthcare policy in order to get your kid or your family member, your loved one, what they need to stay home in their community. It shouldn't have to be this way in, the richest country in the world. And, this should not be a conversation that we're having right now, but, this is where we are.
Yeah. And if I can illustrate that a little bit, I remember going to Annapolis a few years ago before the pandemic, and I was discussing the lower costs of home care alongside, I think it was Bayada, it was a nursing company that was trying to increase wages for nurses in Maryland, which actually happened. And I really got the attention of legislators when we talked about what happens with home care and how the costs are reduced. Because sometimes legislators are just looking at the fact that, okay, you can have, instead of having one nurse serve one person at home, you can have one nurse serve like 4 or 5 people in an institution. However, when you look at it a different way, I mean, institutions, you're also paying for the brick and mortar upkeep of the building. You are paying for someone to open up all the supplies and stock them in the right places. You're paying for someone to cook. You're paying for people to go over the massive correspondence that's involved with managing someone's medical care and their social activities. I mean, I can certainly attest to that, this as a parent, and I'm sure Peter can as well. You know, you have parents and relatives doing this at home. You know, you don't have to pay a cleaning service to come and clean our house. I mean, that's up to us, right? So there are all of these attendant costs to maintaining a building and a huge staff that go away when you're doing home care.
Although maybe they should pay us for following all the paperwork we have to do to get everything right.
Well, in self-directed services in Maryland, and this is a home and community-based program for adults. Robert is in self-directed services, meaning that he gets to decide what he wants to do with his own day. He's not receiving services from a traditional provider who offers a suite of activities, for example. There's a movement to equalize some of those things, so that as young adults like Robert get older and they need more supports, they can have someone assigned to be the administrative person and receive some funds. So yeah, I would say that on the whole, Maryland is really a model state for home and community-based services. I mean, yes, waiting lists are still long, but when you look at the programs, they do a good job, and they're robust. But you know, I mean, Peter and I are fortunate that we've only had to endure significant waiting lists, that once we're in services, that you know, things are going relatively well, and Maryland really prioritizes the needs of disabled people. I would say on the whole, I don't think it's perfect. No state is, but more states ought to look at what Maryland is doing for sure.
Well, thank you very much, Geneva and Peter and Rob, for being on the show today. To conclude, right now, Congress has an opportunity to put more funding towards home and community-based services in whatever they're calling it now. I think it's Building a Better America. The budget reconciliation package that Congress may be working on soon. They could do something to fund the care that our families need. So do you have should people contact their senators? What would you suggest for people to do?
Absolutely. Contact your senators. I mean, Maryland, while they're doing a good job with the funds that they have, we definitely need more funding. We need to get people off those waiting lists. We need to make sure that people with complex medical needs can stay at home all the way through their adulthood. And that's a challenge that Maryland is facing right now in terms of long-term supports and services. We're doing a pretty good job, you know, keeping kids in their communities if they can get services, you know, through childhood and into early adulthood. But gosh, I mean, you know, think of the states where people are waiting. Think of the states where workers are underpaid. You know, and these are women of color. These are often recent immigrants. I mean, people are paid as little in some states as like $11 or $12 an hour to provide home care. You know, we should really be looking at wage ranges of $25 to $50 an hour for this kind of work. It's really complex, and it is skilled labor, and it can be a great job. You know, if we can pay people what they deserve and provide them with the benefits that they need. I mean, taking care of Rob is a joy. Rob is a little sleepy right now. I was trying to get him to smile. He's listening to all of this, and I know he's concerned, like, what's going to happen to me, right? You know, that's on the mind of tens of thousands of people with disabilities and the family members who love them. You know, what will happen long term? You know, we deserve to live at home. We deserve to stay in our communities. We deserve to contribute.
Absolutely. And Peter, anything to add?
Yes. Call, write, text, tweet, Facebook, your member of Congress. Ask them to support investments in caregiving infrastructure. You know, we have worked hard in every, Geneva and I are just, two families of millions of Americans, like us, who work hard every day to, fight the system to get what they need to keep their family member, their loved one home with them in the community. And it shouldn't have to be this way. And it doesn't have to be this way. And, if we can invest in the Build Back Better version 6.0 or whatever we're on and really do this, then yeah, I mean, my son Jackson is going to need these services growing up into a young man like Rob and others. And so we're all counting on everybody to do the right thing here.
Absolutely. Well, thank you everybody for watching. This is Care Talk. Be sure to call and text in your questions and we will answer them in future episodes, and we will be back next week. Thank you.